take turns going first. You know, I definitely think that this is a role of government to kind of set the rules of the marketplace. I happen to think there is a role for competition among multiple insurers and multiple different kinds of providers, but that competition, if it's going to serve the public's interest, has to be structured appropriately, and I think it's up to government to make the rules for the marketplace over what should we compete and over what should we not compete, but rather make sure that there's a level, decent standard of coverage, of basic coverage, below which insurers should not be able to go to cherry pick certain kinds of risks and so forth. So I definitely see that the setting of those rules is a very appropriate role for government, even if we hope to have a market function.
Well, we have in Minnesota policies which have certain benefit sets. And so in Minnesota, as consumers, we are able to have transparency in when we're comparing policies. That's not true nationally. And one of the things that disturbed me greatly about the discussion about selling policies across state lines and that would solve everything is a lot of the protections that we have in Minnesota would be gone. I'll give an example. When I first was elected to the state house, we had to pass a law that told insurance companies here that they would cover needles along with the prescription for the insulin for diabetics. They wouldn't cover the needles. And it was causing all kinds of complications. It was causing hospitalizations in some cases and people not taking their diabetes medication. It saved no one any money and it put people at risk. Pre-existing conditions are really interesting things I'm learning. I met a young girl, toddler, her name's Eve. And her parents took her home and she thought it was going great. And all of a sudden she kind of wasn't thriving very well. Her parents took her in. And Eve found out that she had a little problem with her heart. Well, they were able to correct the problem. The problem will heal. She will be fine. But Eve now has a pre-existing heart condition. And her parents were finding insurance out of their reach. But I do want to talk about what we're hearing now that we have the patient bill of rights is all of a sudden everybody's getting premium increases. That's true. When was the last time you didn't have an insurance premium increase? Insurance premiums have been going up, and what we need to do, and the part of the health care bill that's in here that I hope we have more time to talk about, is what we can do collectively to add value and quality to the medicine we have, and if we do it right, we will reduce the cost of medicine. And I've got all kinds of examples, but I'm sure other people up here do as well, and I'm going to pass the mic.
So one stop in my career, I worked for this little insurance company in Green Bay, Wisconsin. We insured about 500,000 lives in 34 states. So we had 34 different state commissioners of insurance we were accountable for. We employed an army of 15 lawyers, which was 5 times as many doctors as our company employed, to keep track of all the legislative changes in all of those states because we had to remain in compliance. And truthfully, we'd sit down once a year as the legislative sessions would end, and we'd kind of add up which lobbies won in those various states as new mandated benefits or new rules came into effect. Who knew, for example, that if you live in Texas and you are a grandparent, you're a person who has a child of childbearing age, if your daughter gets pregnant, that baby can end up being covered by your policy for all sorts of costs or expenses. But you can imagine the confusion that causes to who's really your patient, how might you as an insurance company try to impact the health of this baby that you might not even know is out there. It's just a mishmash of regulations, and so certainly I think some federal sanity to this would be helpful. The other thing I'd say is I'm not so sure there's really such a thing as a free market when it comes to health care. With the government paying for about 55% of the bill through the VA, through Medicaid, through Medicare, and other things, and setting payment rates, that distorts the market. And if I remember back to my early economics with Adam Smith and the invisible hand of the market that moved entrants gracefully in and out of the market. I remember someone, when I was at Dartmouth once, saying, when's the last time you ever saw a heart surgeon gracefully enter or exit anything? There's just too much built up and invested in the system for a free market approach to really work. Or if we want to, that we don't, the signals that the market is supposed to be sending are blunted and they're not getting through to people.